Welcome to our second video on lysosomal storage diseases. Let's begin. Here is an overview of the diseases we will cover. Specifically, we will discuss Krabbe disease, Gaucher disease, Hurler, and Hunter syndromes. Let's start with Krabbe disease. We will talk about general features, clinical presentation, and management of Krabbe disease. Krabbe disease is an autosomal recessive lysosomal storage disease caused by deficiency of galactocerebrosidase, also known as galactosylceramidase. There's an accumulation of galactocerebroside and cyclosine, the substrates for deficient enzyme. The patients with Krabbe disease have destruction of oligodendrocytes followed by optic atrophy. They also experience peripheral neuropathy. Electron microscopy shows globoid cells, the macrophages laden with galactocerebroside and cyclosine. Here we see the microscopy image showing globoid cells, characteristic of Krabbe disease. Unfortunately, there is no cure for Krabbe disease. Management is mostly supportive, typically involving occupation and speech therapies. Let's move on to Gaucher disease. Gaucher disease is the most common lysosomal storage disease. It is an autosomal recessive condition caused by deficiency of glucocerebrosidase or beta-glucosidase. Consequently, there is accumulation of glucocerebroside. Gaucher disease is characterized by hepatosplenomegaly, pancytopenia, osteoporosis, avascular necrosis of the femur, and the Gaucher cells. Gaucher cells are glucocerebroside-laden macrophages resembling crumpled tissue paper. Here we see the X-ray image showing avascular necrosis of the femur. Please take a close look at increased lucency in the necrotic region. Here we see the microscopy image showing crumpled tissue paper macrophages, characteristic of Gaucher disease. Management of Gaucher disease includes administration of recombinant beta-glucosidase. Hurler syndrome is an autosomal recessive condition caused by deficiency of alpha-L-iduronidase. There is accumulation of heparin sulfate and dermatan sulfate. Hurler syndrome is characterized by skeletal abnormalities, airway obstruction, corneal clouding, and hepatosplenomegaly. Interestingly, corneal clouding is absent in Hunter syndrome, which we will discuss next. This is a patient with Hurler syndrome. Hopefully you can appreciate the clouded cornea in this patient. Management of Hurler syndrome includes enzyme replacement therapy with alpha-L-iduronidase. The final disease we will discuss in this lecture is Hunter syndrome. Hunter syndrome is an X-linked recessive disease caused by deficiency of iduronidate 2 sulfatase. There is accumulation of heparin sulfate and dermatan sulfate. Hunter syndrome is similar to Hurler syndrome in a sense that it is also characterized by skeletal abnormalities and hepatosplenomegaly. However, Hunter syndrome has no corneal clouding and is characterized by aggressive behavior. Management of Hunter syndrome includes enzyme replacement therapy with iduronidate 2 sulfatase. A 10-year-old boy is brought to the physician due to severe fatigue and a right hip pain. His fatigue has been present for several years while his hip pain started 2 weeks ago. He cannot bear weight on his right leg. His vital signs are unremarkable. The physical exam shows hepatosplenomegaly, tenderness on the right hip palpation, and several diffuse petechiae. Laboratory findings are significant for hemoglobin of 7, white blood cell count of 2,000, and a platelet count of 60,000. X-ray of the right hip shows decreased bone density of the femoral neck consistent with avascular necrosis. Bone marrow biopsy reveals the cells with crumpled tissue paper cytoplasm. Which of the following is the best treatment option for this patient? A. Recombinant sphingomyelinase. B. Recombinant beta-glucosidase. C. Systemic chemotherapy. D. Anti-thymocyte globulin. This patient presents with fatigue and right hip pain consistent with avascular necrosis of the femur. He also has pancytopenia marked by decreased hemoglobin, white blood cells, and platelets, and the bone marrow biopsy reveals the cells with crumpled tissue paper cytoplasm. This description is classic for Gaucher disease. As we discussed in this lecture, Gaucher disease is an autosomal recessive lysosomal storage disease caused by beta-glucosidase deficiency. Therefore, the best treatment option for this patient with Gaucher disease is recombinant beta-glucosidase. The correct answer is option B. This is the slide that we discussed earlier in this lecture, reminding us of the management of Gaucher disease with recombinant beta-glucosidase. Let's discuss why other options are incorrect. Option A, recombinant sphingomyelinase, is incorrect because it would be used in Niemann-Pick disease. Niemann-Pick disease, on the other hand, presents with hepatosplenomegaly, neurologic impairment, and the cherry red spot on the macula. This patient has no neurologic abnormalities. Option C, systemic chemotherapy, is incorrect because it can be used in leukemia. Although this patient has anemia, thrombocytopenia, and hepatosplenomegaly, His white blood cell count is also low, making leukemia less likely, which typically presents with increased white blood cell count. Finally, option D, anti-thymocyte globulin, is incorrect because it is usually used in primary aplastic anemia. Although this patient has pancytopenia, characteristic of aplastic anemia, he also has avascular necrosis, hepatosplenomegaly, and the bone marrow biopsy showing crumpled tissue paper macrophages. These findings are not characteristic of aplastic anemia. And that concludes our lecture on glycogen and lysosomal storage diseases.